Hi everyone, and welcome back to my weekly Sunday 9 p.m. live video. I'm Dr. Tan Ping, consultant, obstetrician and gynecologist. Now I'm going to talk about something that is very gynae related. That is a question that was posted up by someone. She has irregular menses and she's actually worried whether she can get pregnant or not. Actually, I think a lot of women who have irregular menses always have this question in their mind, whether will they be able to get pregnant if they get married, So there are a few things you need to understand about these irregular menses. There are two situations of irregular menses. One is those people who all along have irregular menses. You have irregular menses since you're a teenager, in your 20s, in your 30s, forever irregular menses. There's another group of women that usually have regular menses, but at a certain point of their life, they started having irregular menses. Ultimately, there is one question you need to answer. There's only one question you need to answer. Because a lot of patients will come and tell me, Doctor, somebody said I'm PCOS. Do you think I have PCOS? Or sometimes they call PCOS. Doctor, do you think I have PCOS? Because some doctor told me I got PCOS. Do I have PCOS? Is it because I have PCOS I cannot get pregnant? To me, I will always tell them this thing. Whether you have PCOS or not, it is not important at all. It is not important at all. Whether is it because PCOS cause you cannot get pregnant, it is again not important at all. It is not important at all. Because number one, PCOS is defined as polycystic ovarian syndrome. It is a syndrome. It's not really a disease. It is a syndrome. It is not a disease. It is a syndrome. It means that it's some features that we see in a collective syndrome. We say it's a collective of features. So there are certain features. Some person have a certain number of features, and if you fit that certain number of features, means you have polycystic ovarian syndrome. So it is not important at all. When it comes to pregnancy, it is not important whether you have PCOS or not. Whether you have regular menses or not regular menses is not important at all. What is more important? What is more important is whether you ovulate or not. Because we know that when you have irregular menses, you must understand that women have two types of menses, which is ovulatory menses and non-ovulatory menses. So when you have menses, it doesn't mean you ovulate. So we want to know whether you are ovulating or not ovulating. One thing we know, women with regular menses, they usually ovulate. If your menses is regular, you usually ovulate. Not 100%, can say 99% of the time. But when you have irregular menses, then number one, you could be not ovulating, or you could be ovulating, or you could be ovulating sometimes but not always. What I mean, like you have irregular menses. Let's say you only got 8 menses in a year instead of 12. Out of the 8 menses in the year, it could be all 8 not ovulating. It could be all 8 also ovulating. But it could be 3 ovulating, 5 not ovulating. So 3 different scenarios. So it could be, we don't know. So how to know? We have to do scan. We have to do serial scan to catch your ovulation. The only way to do that is to do serial scan. Not do blood tests. A lot of you come with result with the blood test of day 21 progesterone. If your period is not regular, your day 21 is no longer correct. Because that blood test, it is a very particular blood test. You have to do it on the correct day, which is 7 days before your next menses. Think about it. 7 days before your next menses. If you don't even know when is your next menses, how to know what is 7 days before your next menses? Am I right? So there's no way you can tell. So this is the thing that you need to understand regarding this cycle, ovulation or not ovulation. So you cannot be using blood tests. You need to really look at serial ultrasound scan to catch your ovulation. If we can catch your ovulation, means you're ovulating. If you are ovulating, it doesn't matter whether your period is regular or not regular, you will still be able to get pregnant. But if you're not ovulating, then you will never be able to get pregnant. Let's say you have 8 menses in 1 year and all 8 menses never ovulate. How to get pregnant? Impossible to get pregnant. If you have 8 menses in 1 year, but you have 3 that's ovulating, 5 that's not ovulating, of course you can still get pregnant, but your chances is not so high. It may take time. So my only advice for women who plan to get pregnant, if let's say you plan to get pregnant and you have irregular menses, the first thing you need to know is never, 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 never try to get pregnant on your own for years before you see the gynae. That is like the stupidest thing to do. Why? Because if you're not ovulating, you wasted the number of years. It's very typical. Women come to see me after 2 years, 3 years, 4 years married. Married for so many years, period is irregular, never seen gynae before. Because they're not pregnant after so many years, then only they come and see gynae. Then I will tell them, you have just wasted so many number of years. So what is the best time to see gynae when you want to get pregnant? If you have irregular menses, you should see the gynae the moment you want to get pregnant. Like this month, I want to start getting pregnant. This month, I'll see my gynae. I want my gynae to let me know whether I'm ovulating or not. Because if I'm ovulating, then okay, I chill. I go back, I try and get pregnant on my own. But if I'm not ovulating, then I want to start treatment. I start treatment straight away. Because this is what I did for myself. I also have PCOS and my menses have never been regular all my life. So the moment I plan to conceive, I immediately start medicine. I knew I'm not ovulating, no need to waste time. Straight away start. Okay? So that is the most important message I hope that you get. If you plan to get pregnant and you have irregular menses, you should see the gynae the moment you want to get pregnant. To ask the gynae whether I'm ovulating or not. Whether I need any medication to help me ovulate. Because if I'm not ovulating, I want to start my medication now. I don't want to waste 3 years, 5 years, and then only I know that I have this condition and I'm not ovulating and I wasted so many years. Okay? So if you want to know more about PCOS, I have other videos on PCOS and irregular menses as well in my YouTube. So you go to my YouTube channel, Dr. Tan City's Clinic. Remember, to subscribe and like my videos and turn on the notification button, okay? So for PCOS, if you want to know more other than the aspects of fertility, you can always go to my YouTube channel, okay? Another thing I just want to explain, because earlier I mentioned that irregular menses, there are 2 types. One is all along irregular, and one is all along regular, but now only irregular. Certain time onwards only became irregular. So both these situations actually is the same. Basically, we want to know whether you're ovulating or not ovulating if you want to get pregnant. But it is actually a lot better if you already have irregular menses all your life. It's better not to wait until you married only see gynae. Sometimes there are a lot of things that we could do before you're married. Sometimes when they come to see me, then we know that if you had come and see me 1 year or 2 years before you get married, I could have done a lot of things. Maybe I could have changed you from a irregular menses lady to a regular menses lady. Or from no ovulation to ovulation. So when you get pregnant, when you get married, you can straight away get pregnant. You don't even need any medication to help you. That will be a lot more ideal. And if let's say you all along have regular menses and now your menses become irregular, then it's very important that you go and see your gynae, because number one, we need to find out why your period become irregular. You know, when you're always regular, it cannot be irregular already one. So we need to see gynae to find out the reason. And very often, if we find the reason, we can already do something for you, so that by the time even when you want to get pregnant, it's no longer a problem, okay? Because there are a lot of situations for irregular menses that can be corrected. Even in PCOS, it can be corrected. Okay. Amy asked if on Yasmin for adenomyosis and planning for pregnancy, when should I stop my Yasmin? You stop today. After 1 month, you can. Actually, you don't need to wait to get pregnant. But most of the time, we ask people to wait for 2 menstrual cycles. Reason is not because of the effect of Yasmin. It's not because Yasmin cannot get pregnant. No. You can get pregnant even when you're taking Yasmin. There's no problem. But only thing is that we want your menses to come regular back before you get pregnant. It's all purely based on whether or not so that we know when you got pregnant actually. Because when you get pregnant, we always count your due date and your timing of getting pregnant and your number of months of pregnancy, all based on your last menses. So if you take Yasmin, normally after you stop your menses, your menses will be irregular for a few months. So that few months actually is haywire one. So if you get pregnant, then it's not easy to count, or we may count the dates wrongly because actually your menses is not regular yet. It's not really a big problem because ultrasound can solve that problem, because ultrasound machine can count your due date anyway. But some of you come to us like 5-6 months pregnant, so then it's too late to change your due date, so then it can be a problem. So that's why we advise women to wait for 2 normal menstrual cycles before you get pregnant, but it is not a must. Okay, Laureen Tan asks, if breastfeeding with regular menses, is it possible with non-ovulating menses? Okay, as I say, if you're having regular menses, it doesn't matter whether it's breastfeeding or not. 99% of women actually have ovulating cycle. 99, not 100. Usually regular means ovulating, but it's not 100%. So we can't tell. If you are not sure, you can always just go and visit your gynae. Go around like day 14, day 13 or day 12, at least day 12 onwards, and just ask your doctor whether you are ovulating or not. Mei-Ling asks, I gave birth 6 years ago and trying to conceive second baby. Period has always been irregular. Do I need to check if I'm ovulating or not since I was successful the first time? Yes, Mei-Ling, you need to check. Because people can be ovulating all along and now not ovulating. Especially when you talk about things like PCOS. PCOS worsens with age. When you are younger, your period may be irregular, but you may still be ovulating. When you grow older, your period is irregular. Half of it will be ovulating and half of it is not ovulating. When you grow even older, then it can be totally not ovulating. That is number one. Another thing with PCOS is, as you put on more weight, then you become more, you actually stop ovulating. So typically a lot of time we notice in women is when they get pregnant, they put on a lot of weight. They put on 20 kg, 30 kg. So by the time you put on 20 kg, 30 kg, after you give birth, you're no longer the same weight as you were before you were pregnant with your first baby. And that would have stopped your ovulation as well. So definitely, Mei-Ling, you need to go and see your gynae to check on your ovulation status, yeah? Because if not, you may actually be totally wasting your time. You may be totally wasting your time, and that is why you're not getting pregnant. And so that's all for today. So before I end my video, yeah, so remember to go to my YouTube channel, Dr. Tan City Clinic. Please subscribe and also like my videos and turn on the notification button, yeah? And for more explanation on PCOS and all the things that's related to PCOS, you can always go to my video for PCOS, irregular menses and weight gain that I had a long time ago. It is there in the YouTube channel. So that's all for now. Stay safe, everybody. So remember, keep your mask on at all time. Thank you. Bye-bye.